Hi, I'm Dr. Jim Bellamy. I'm the program director for the Bachelor of Science in Public Health program at Old Dominion University. It's one of only 2 Bachelors of Science in Public Health programs in the state of Virginia. One of the things that we have some difficulty with is trying to explain exactly what is public health. And for me, I use a very simple definition. It's what we do as a community to make a community helpful. So there's so many different things involved. Whether you're talking about healthcare, whether you're talking about housing, transportation, it's just a whole gamut of things that we do in public health. And that's one of the things that drew me to public health. It's making sure that my community is as healthy as it can be. And I'd like to introduce to you an alumni of our program, Anna Davis. She's actually going to Drexel for her master's in public health and epidemiology. So, and infectious disease. So she was such an integral part to the program, and we truly miss her, but we're glad she's going to be able to go on and do great things. So the first one is, tell us about yourself and why you chose to pursue a career in public health.
Okay, so I am a recent graduate. So I just graduated this May, and I am a health science major, concentration public health. I minored in business analytics. Some things that I was involved with on campus: I was on the women's lacrosse team. I was also in the honors college, and I also held some campus jobs. I was a campus ambassador, so I gave tours on campus. I was a peer academic tutor. I was also a tutor counselor as well. And why I chose public health: I'm actually currently about to go to graduate school at Drexel University to get my MPH in epidemiology and infectious disease. And I really love public health because it's a multidisciplinary field, and it really encompasses a bunch of different aspects of science. I was never really set on medical school, but I knew I loved science, I knew I loved health, and I knew I loved math and puzzles. And I really like to kind of incorporate a bunch of different fields. So public health utilizes science in all different aspects. My classes allowed me to take the bios, the chemistries, but it also allowed me to take business classes as well. It allowed me to take administrative classes. It allowed me to be in leadership roles, and I've been put in situations that allowed me to grow as a person and as a leader, and I can apply that to the health field, and that's what I really love about public health.
Well, thank you very much. And that's one of the things that really drew me to public health as well, is that it's multidisciplinary. There's just so much there that you can get involved with, depending on whatever interest you have. So I appreciate that answer. Yeah. So the next question is, for current public health students, tell us what it's like to be a student in the program and about your internship experiences.
So to be a student in the program, you would first take some of your undergraduate classes. So you're going to take your gen ed classes your first few years. And generally you'll take those your first 2 years, and then you'll actually apply into the public health program. I actually took intro to public health my first semester here at ODU. And I chose to do that because I wanted to actually see if public health was the right decision for me. I didn't want to start by taking all my gen eds and then get into my public health classes later down the road, just in case I decided I wanted to switch majors. I just wanted to really get my heart set on public health early. And I think that really worked for me because it got me introduced to the professors really early. It also exposed me to the health science building really early, because that's where your classes will be. All of your public health classes will be inside the health science building, which is great. And it makes it really nice because that's where all the professors are located as well. Also, I think that the class sizes for the public health classes are very good for your learning as well, because they're usually like 20 to 30 students. They're not super large like some of the other lecture halls. When you take your gen ed classes, like your gen ed bios and your gen ed chemistries, those will be a little bit larger. But then as you wean down into your actual public health classes, that's when you hit those, 20, 30 size student class sizes. So it's a lot more easy to actually comprehend what you're learning, and you get that one-on-one time with your teacher. I personally had a very strong connection with my and teachers and professors that I had here at ODU. And as a public health student, you can make great relationships with them. They all have office hours. And like I said, they're all located in that health science building. So you can always just go right over there.
Thank you. And I really like your strategy of taking that the intro to public health early. I mean, that kind of helps guide you in the direction you want to go. So I hope students, incoming students kind of take that to heart and think about maybe doing that as a little bit earlier in their program instead of waiting towards the end of their gen eds. So that's a good strategy. Appreciate that. All right, number 3. For our alumni, tell us about your role and where you're currently working as a public health professional. I know it's a little different for you, but go ahead and give us a.
So I guess I can talk about my internship a little bit here. So I, last summer, I interned at Janssen Pharmaceuticals, which is a pharmaceutical company of Johnson & Johnson. And I did my internship in Pennsylvania, and that's actually currently where I'm from. I didn't mention that in the beginning, but I am an out-of-state student. And at Janssen, I worked as the gastroimmunology therapeutic area intern, and I worked on a clinical trial for Crohn's disease. And I helped do medical monitoring for that clinical trial. I did a lot of data analysis. I presented. And it was a really great experience because Janssen and Johnson & Johnson, they do a lot for their interns. They have a bunch of different people from different departments and different therapeutic areas is what they call them, come in each week and speak to us. They have lunch and learns, and they have a lot of different networking opportunities for their interns. So it was a great experience. It was a 12-week internship. It was paid. As a public health student and a health science student at ODU, you are required to do an internship. They work, or the professors and the faculty work well with you to help you find a great internship experience for you. And it can be through ODU. It doesn't have to be through ODU. And it can be paid, and it does count as a class. So it's a great experience. You can do it in your last spring semester. You can do it in the summer. So that's a great opportunity in the door, and get some professional work experience before you actually go out there and start looking for a job.
Thank you. And yeah, the internship is designed as a bridge between going from a student to a professional working in the field. And we've had students take their internships all over the world, really. And a lot of it, your internship is going to be based on what interests you. So, that's something that students need to think about as they start going through the program. But it sounds like you had a great experience in your internship. So thank you. All right. What advice do you have for incoming students considering public health?
I would say my biggest advice is to interact with your professors. I know that a lot of you may be a little bit nervous with our current situation with classes maybe being online. I will say that some of the public health classes are online just in general, which I actually did enjoy, because it did allow me to take some of my other science classes, which did involve labs in person, and some of my science classes did take more time. So I was taking some classes like organic chemistry or my bio classes with labs that had some longer labs. So having my public health classes online allowed me to kind of multitask and do both of those at the same time. That being said, with having some of the public health classes online, I really made a strong effort to interact with my professors, and it really benefited me in the long run. Like I said earlier, your professors are all located in the health science building, regardless to whether or not they are teaching a class online. They all have office hours, and they all have a remote location. So please, 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 I advise you to make an effort to go in there, whether that's you have a homework question or you just want to pop in and say hi. They really appreciate that, to put a face to your name. My other advice is to have a little bit of fun in college, to kind of learn to have a work-life balance. You're here for 4 years, and I think that if you are enjoying yourself in your 4 years, then it's going to pay off in the long run in your schoolwork. You want to have a good college experience. I had a great college experience. I joined clubs. I was on the lacrosse team. I made a strong friend group. And if you have a good support system around you, then it's going to really show in your schoolwork. And at the same time, you're going to be networking as well, because you never know who the people around you are going to meet, or what their jobs and careers are going to be, and how they can help you in the long run.
All right, thank you. Yeah, and from a faculty perspective, we really like interacting with the students. We like getting to know you, and it really helps us help you as well when we're trying to figure out what kind of internship you want, what do you want to do after you graduate. So we're trying to position you to be successful. And when you interact with us, that helps us tremendously. And we love it when you come to us and talk to us. And so it's building that relationship, as Anna said. And the other thing that she brought up that I thought was really good was be involved, get involved with things, because the more people you know that you need that support group. And when you're involved, I think it just makes your experience so much better than just sitting on the sidelines. So I think those were two wonderful pieces of advice that Anna gave us. So on to the next one. What do you wish you would have known as a freshman? Right.
I definitely think I just wish I knew more about downtown Norfolk and this area of ODU, and like Norfolk in general, especially being an out-of-state student. I think that there are so many hidden gems and things to do in this area. And honestly, in my last 2 months before leaving ODU, I was walking around downtown and was like, oh my gosh, I've never seen this before. Or I was on the Elizabeth River Trail and I have never walked on that before. And there's honestly so many cool places and little mom and pop shops and things to do and great places to be outside. So on your weekends, I would definitely say explore the town and explore downtown, go to the Waterside District. There's a lot of cool areas to be. It's definitely an arts district. It's definitely a growing district, and definitely something that I wish I knew when I first came to ODU, because I definitely did not know any of that. So I would definitely say that.
Yeah, there's quite a bit to do in the area. And like you said, I would encourage students as well to take advantage of that as well. So what resources or special opportunities did you take advantage of while you were at ODU?
I would say the free tutoring that ODU has for our students. This is all peer run, so it is peer tutoring, meaning that it is students that are actually offering the tutoring for you. But this is very beneficial because a lot of times it'll be an upperclassman that is tutoring you, and it is someone who they definitely got an A in the class before, but they also may have had the exact same teacher that you had. So they know how the class is run, they know how the teacher presents the tests, things like that. So we have the Math and Science Tutoring Center. We also have a separate center specifically for chemistry. And the Math and Science Tutoring Center is located in the library, and the Chemistry Testing Center is located in the Oceanography and Physics building, which is our physical science building on campus. So I would definitely utilize the tutoring centers. We also have career development services, which I've also utilized on campus. You can use them if you want to get your resume looked at, if you want to do mock interviews, if you have like an internship coming up or a job coming up and you want to practice an interview. That's really awesome. They actually even have like spaces where you can reserve if you have an interview coming up and you just need an area where you, like a quiet place where you want to do your interview. So you can actually reserve that, which is really nice. Yeah, so I would say those are the two biggest resources that I've used on campus.
Thank you. Yeah, I came from an academic medical center where we did not have the resources that ODU has in student development. All the different tutoring services, the writing laboratory is another good service that we provide at ODU to help students increase their ability to write. So that's something that you can take advantage of as well. Career development services, like Anna said, is incredibly helpful. We actually pair you with them while you're getting ready for your internship. So that's another invaluable source that we have here at ODU. So I guess the next thing would be, what's the most impactful or memorable thing to you in your experience at ODU, and why?
I definitely would say the faculty that I had. I did not think that I would connect so much with faculty here, but I did. My first 2 years, I like thought that I was just going to be, a number, because I was like, oh, ODU's a pretty big school. We're like a mid-sized metropolitan school. There's, like, I guess if you look at the number, it says like 25,000 students or something like that. But I would walk around campus and, see a bunch of familiar faces, and then see a bunch of people I never knew before. And I would kind of sit in class and I would be like, like, what am I going to do to make myself stand out? And that's when I really started to try to introduce myself to my professors. And I was really surprised when they actually started to, remember my name and call on me in class, even though we'd be in a big lecture hall, and just like acknowledge me if I was walking down campus and even wave. And I was like, oh, wow, like things like that just really started to surprise me. So then I started to make even more of an effort and go to office hours and just say hi. And then one of my health sciences professors was actually my game day professor for lacrosse, where we honor a professor that was really impactful to us. And then I also would always stop. Dr. Bellamy was actually my advisor. So, which is something I didn't mention before. You do have an advisor as well, which is another great resource that we have here at ODU. And your advisor is with you all 4 years, and they kind of just make sure that you're on track to graduate, but they're also a great resource to you. And I would literally go into Dr. Bellamy's office and talk about grad school, or just email him throughout the summer. And same with my other professor as well. So things like that, I just felt like I was making great connections throughout my 4 years. And I didn't expect to do that when I came here as a freshman. So I would say that really made OU memorable for me.
And, for us too, as faculty, we just love it. We love that student interaction. You get to know the student. When they graduate, you feel a sense of accomplishment as well. when you see your students graduate and you see your students go on and be successful. That's for me, that's one of the main reasons why I do it. I just love that part. And Anna, like I said before, you were such a great part of the program, and we truly miss you. And I know you're going to do great things at Drexel, and we'll see you at the CDC one day probably. So
Hopefully. Thank you.
you're welcome.